Hey guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, please subscribe and follow the playlist from the beginning so that you understand all the concepts thoroughly. This is part 25 of the Inpatient Coding Series, and today we will learn about the root operations in ICD-10-PCS. I'm Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry, with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for medical coding certifications. I'm dual certified both from AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. So, at this end of this learning session, we will have a better understanding of coding the root operation drainage from the second group of root operations. We'll look at an example of coding from the medical and surgical section. And remember, the medical and surgical section is the most important and the biggest section in ICD-10 PCS. As you all know, there are a total of 31 root operations in the medical and surgical section, and these root operations are divided into 9 groups based on similar kinds of procedures or procedures with similar attributes. Today, we are looking at the second group of root operations, which talk about root operations that take out solids, fluids, or gases from a body part. Now, there are a total of 3 root operations in the second group: drainage, extirpation, and fragmentation. And today, we are talking about the root operation drainage, which carries a character value of 9. Root operations are very important in building an ICD-10 PCS code. So remember, you always have to look for the objective of the procedure or the goal of the procedure, which defines the actual root operation. And identifying the correct root operation is very important in ICD-10 PCS. Now, drainage. So drainage is defined as taking or letting out fluids and or gases from a body part. Now, drainage procedures which are performed for the purpose of a biopsy. Okay, so all biopsy procedures have a seventh character value of X, and this X identifies that it's a diagnostic procedure. Now, sometimes a drainage device may also be placed inside after the drainage procedure is completed, such as an indwelling catheter. Okay, so in those cases, the sixth character in the code identifies the type of device that is left inside. Now, these are the examples of procedures that fall into the root operation of drainage: thoracentesis, all incision and drainage procedures, aspirations, and lumbar punctures. Now, remember, specifically for lumbar puncture, you need to understand the intent of the lumbar puncture in order to identify the correct root operation. Okay, lumbar puncture is performed to drain spinal fluid from the spinal canal and is done for both therapeutic and diagnostic purposes. So, if it is done for diagnostic purposes, then you might need to code it as a drainage procedure. You have to review the medical record very carefully to identify whether it's a biopsy where the spinal fluid is drawn, or it's a therapeutic procedure where the spinal fluid is reduced for treating a condition. This is an example of coding drainage procedures. The patient is being evaluated for septic arthritis of the right knee. So a needle arthrocentesis was performed on the right knee with 15 cc of fluid being removed. So basically, this is a joint aspiration procedure that is done to check if the patient has septic arthritis of the knee joint. So this is how the corresponding table looks like. Okay. Now this one shows the right knee arthrocentesis procedure. Section is medical and surgical. Body system is lower joints because the procedure is being done on the right knee joint. And remember always, anything above the diaphragm is upper, and anything above the diaphragm is considered as lower. Since the knee joint is below the diaphragm, it is considered as a lower joint for the body system value, the second character. Okay. The third character, root operation, is drainage. The fourth character, body part, is right knee joint. Approach is percutaneous since the procedure was done by inserting a needle and not a scope. Okay, no device for the sixth character. And the seventh character is X because this is a diagnostic procedure. So the code for the arthrocentesis of the right knee joint is 0, S, 9, C, 3, Z, and X. So the key points to remember are diagnostic procedures such as aspirations and incision and drainage procedures carry a seventh character value of X, which identifies that it's a biopsy procedure or a diagnostic procedure. Okay, and be careful with the approach values for drainage procedures specifically. Some procedures are done using a scope as well as uh, a needle. Okay, if a scope is used to perform the procedure, then the approach would be percutaneous endoscopy. But if it's only a needle biopsy or a needle procedure, then the approach is only percutaneous. You'll find the online version of the ICD-10-PCS coding manual from this link. This is from the CMS, so you can download it and use it when you are doing the practice. I also placed it in the description of the video, by the way. Thank you guys. Thank you for watching. Please subscribe to the channel if you have not done that already and follow the series from the playlist for the complete set of videos. In the next set of videos, we'll talk about the second group of root operations from the medical and surgical section. We started with drainage today. The next one would be extirpation. And we'll also add the ICD-10 PCS official guidelines along with the procedures. Thank you.